So I'd like to welcome everybody back to my YouTube channel. This is called A Modern Healer's Journey. I'm Tammy Bennett, and I'm pleased to have my friend and colleague, Robin Kunkel, here on the line with me. And we're going to talk today a little bit about how we met, how acupuncture has worked for her. I'll maybe bust a few myths about acupuncture along the way. We'll talk about Robin's career as a chiropractor and her subsequent career as a hypnotherapist. A little bit about something that's personal for me regarding hypnotherapy, and take you on that journey, and maybe do a deep dive in the future about some of these topics as well. Welcome, Robin. Thanks for coming on.
Oh, thank you for having me. I'm excited.
Absolutely. It's a beautiful Saturday morning. My eye line is looking out at a beautiful tree line area. So we're lucky to have some good weather today.
We're lucky to live in Florida generally, so it's great.
True. So tell the viewers on the show how we actually met and a little bit about your history in chiropractic and hypnotherapy, and then we can kind of get into a little deeper conversation about those things.
Okay, so Tammy and I actually met at a business networking group, and I had recently started my hypnotherapy business, and Tammy, of course, is the acupuncturist extraordinaire, if that's it. So I actually have a question. Should we say acupuncturist or doctor of acupuncture? I always say acupuncturist.
That's actually an excellent question for the audience. So technically, in the state statute in the state of Florida, 457 is what covers my practice. It allows me to use several different titles behind my name, not in front. That's reserved for doctor, right? For an MD or a DO or a doctor of chiropractic. So with acupuncture, behind the name, it's either LAC, which is licensed acupuncturist, or DOM, which is Doctor of Oriental Medicine, or OMD, which is Oriental Medicine Doctor. I chose Oriental Medicine Doctor just for my own advertising purposes, because LAC seemed to be more like a certification versus the 3.5, 4 years of education required to graduate in the state. So I use Oriental Medicine Doctor. But when someone says, hey, this is Tammy Bennett, Oriental Medicine Doctor, it doesn't really roll off the tongue. So I go by Tammy. I ask my patients just to call me by my first name, but I am an acupuncturist, doctor of Oriental Medicine.
Right. When I refer to you to other people, I say Dr. Bennett, but as they get to know you, of course, and you would say Tammy. So thank you for that. So we met at this business network group, and you are always also looking for other products that can help people, that can supplement in their health. And so you were actually there in that group for that, and not necessarily promoting yourself as a acupuncture doctor. And it took me a little while before I came in, not because of any hesitancy, just because I didn't feel I needed it at that point. And I had actually studied in my chiropractic practice only 100 hours of acupuncture, certainly not enough to be called an acupuncturist or anything like that. But so I had a general idea what acupuncture was. And we would meet for lunch and talk. And you were always so into people's health and what could you do to help them and how could you support them. So the more I met with you, the more I really liked you. And eventually I did come in because I have an ongoing GI issue that you have been helping me with. GI is gastrointestinal, so reflux, stomach pain, things like that, as well as a chronic neck and mid-back condition, which you have also helped me with. So that's how I came into you. What else do you want to know about that?
Well, I guess I'm curious about the back itself, because originally when I first met with you and we had that lunch date, we talked about the fact that you exited chiropractic because of the pain that you were in, which would,
Right.
to me, if I exited my acupuncture career, it would be significant that that
Mhm.
injury or that condition would be severe enough that would take me away from my income. So, was it an injury initially for the audience, or was it a chronic musculoskeletal condition that took you out?
It was probably the only time I remember injuring myself while I was in practice, believe it or not, was sort of in the beginning, and I was bowling of all things. And I remember pulling, my neck and upper back, but it was early on in the practice and it didn't stop me from that. And earlier in my life, I had car accident as a passenger when I was like 9 or 10. And then when I was in chiropractic school, I also had a car accident where someone just cut out in front of me. And the reason those things can show up later on is, well, I'm going to backtrack. I'll get to why that could be. So I was in practice. I opened my chiropractic practice in January of 89, and I wound up having to sell it in 98. And over the years, my neck, my upper back, occasionally my mid back. My mid back is more of a thing now, I think more related to my gastrointestinal issues. But it would get worse and worse and worse. So think about people who have carpal tunnel syndrome, and they will talk about that being a repetitive stress kind of injury, from overuse or repetitive use of your wrists. And I think that is what actually happened to my neck. I did have a really busy chiropractic practice, and I was a manual adjuster for the most part. I liked getting in there and using my hands, and I would also do trigger point work and then my flexion distraction work, which is where the bottom part of the table will be going up and down. But there are tables that do that automatically, but I had one where I would push down. And so I was very, very hands-on. I had a very busy practice. And I think for over the years, it started to create problems, so that when I left, I had a number of issues. I had cervical and thoracic plexus problems, which are scar tissue in the area of the lower neck and the upper back. I would not be able to feel my hand by the end of a day. I would have incredible headaches that I hadn't had since I discovered chiropractic and actually saw a chiropractor, although I grew up with headaches. I had such weakness in my right arm by the end of the day, and it was getting worse and worse and worse. And I loved what I did. I loved
Yeah.
chiropractic. I got to see true miracles in my practice, and I miss that. But the thing that actually pushed me to sell was my son was an infant, and it was the end of a day, and I went to carry him and I almost dropped him because my right arm had gotten so weak and I was in so much pain. And I realized that the condition wasn't getting any better. It was only getting worse, even though I had, I had seen my friends for treatments for adjustments and doing stretches and all that. But the condition itself was getting worse. So that was what motivated me to sell, was really couldn't drop my baby. And also I
Right.
needed to be, I'm trying to think of the words, but I needed to be healthy to take care of my family, to take care of myself. And I know people who run themselves into the ground, but it doesn't help anyone in the end. So
Yeah.
that was
So
what?
you had the practice for roughly almost 10 years.
Almost, yeah.
Okay. And so we can look back and say repetitive motion was probably the worst part of it for you, possibly some carryover from the old auto accident, and scar tissue developed over
Hmm.
time.
Hmm.
So, what did you do in the period where you ended the chiropractic career? I know you raised two children.
Hmm.
And did you seek medical attention or other attention with different treatment modalities during that period of time until you found hypnotherapy? What was that like?
Well, actually, hypnotherapy I never did for my neck. So what happened was when I sold the practice, I was not in great shape. And I was always going for chiropractic. I really try to avoid drugs. So I can't say I never take medication, but I really try to avoid drugs. There was no surgery. I had been to neurologists. I had been to, and surgeries last, by the way. It was, we always said chiropractic first, drugs second, surgery last. But there are
no acupuncture in there?
Sorry, it wasn't part of the statement, but acupuncture for sure. I mean, I would send my patients, I didn't know you then, but I would send my patients for other alternative modalities and
Gotcha.
at other times to the medical profession. You know, when someone comes in to a chiropractor, you need to really evaluate whether they are a chiropractic patient or if they're not, what could they be? Acupuncture. But beyond that, medical. So, as an example, one of my earliest patients that I sent out, and I remember this because they were really angry at me, was they came in with lower back pain. And I always insisted on taking x-rays. It was one of the things that we were taught to do when I was in school. And I know that there's a lot of pop-up places around right now where you could just walk in and they're not x-raying you. And you know what? For at least 80% of the population, that'll be okay. They're not going to get injured. But I can get 2 times, and I'm sure there were more, but the 2 that are in my head right now was this first one where this man got very upset with me. He had been to chiropractors his whole life. He was older, and he just wanted to come in and get adjusted. And he did not even mind that I needed the x-rays. He understood that. But when I looked at his lumbar or lower back x-rays, he had an aortic aneurysm. So had I adjusted, and he also had something called a spondylolisthesis, which is a really big word, which pretty much means that the last lumbar or lower back vertebra was sliding on top of the sacrum. And it's not like sliding back and forth, but because there's ligaments and stuff holding then, the bones in. But one of the treatments for a spondylo is to have somebody lay on their back and you're actually pushing into it. Well, had I done that, I could have burst his aortic aneurysm. So I sent him out, and actually it was a surgical emergency. He had surgery within a couple days, and aortic aneurysms can cause low back pain. So but initially he was very angry that I wouldn't adjust him. And then
I understand completely.
Yeah. The second time was this real sweet woman, and then she was coming in complaining of pain up here. And, nobody presents like the books tell you when you're in school, but this lady actually did, with something called a Pancoast tumor, which is from lung cancer. And so usually it's a smoker, and there's withering away of the muscles up in this shoulder area. And she had that. But what was interesting is she had been to 3 medical doctors first, and nobody took x-rays and no one looked at her. And I think that one of the reasons I was so busy was that when people came in, I would listen to them, and you look at the areas that hurt them. You touch them, you look at them. And in chiropractic, could be a little different. They can have, let's say, elbow pain that could be coming from their neck. But you start by touching their elbow and letting people know that you heard what their symptoms are. And then you take a look at the whole patient. But her x-rays showed that whole upper area eaten away by this cancer. And I just thought of it. I had a number of patients like that. We don't need to go into all of them, but I'm sorry. When I talk, I'm like, I go off on these tangents. So
I see how passionate you are about people.
Yeah.
And that's one of the things characteristics that we share. I think that's why we became friends through that organization, was more outside of trying to get each other business. It was more about compassion and care.
Right.
And I think sometimes in the system that we have now, and maybe you should come back on the show and talk about this, the system now, as it's grown since I started in practice, I started in 98,
Mm-hmm.
which is when you sold your
Mm-hmm.
chiropractic office. Um, it was a different world. I mean, like the advent of those computerized notes systems and the way that the insurance has driven the industries, all industries,
Right.
within holistic and traditional medicine, it's become this other thing, and it takes up the time away from the patient. So I want to fast forward to something. The reason that I got to be interested in you on the hypnotherapy side was that not only myself, but some of my patients were suffering with situations that, although I have some tools in my kit to help people with mental, spiritual, emotional, you take it to this other level in hypnotherapy. And I was really struggling with some issues, mostly dealing with like my grandparents and some things related to, I had 3 dogs in a row that, my fur babies that had gotten sick. They were much older. I had never had old dogs before. All my dogs lived to be 17, 18 years old. So my brain wasn't thinking about how to take care of an elderly dog. I thought they would just live forever. And then one night they would be on their pillow and go to sleep and go over the Rainbow Bridge. And there we go. And it was not like that. And I was traumatized. And it was, my work was suffering terribly as a result. I felt so sad and so guilty and all that. So I bring it to you to talk about what was the skip up into hypnotherapy for you? Where did it come from? How did that passion get started for you?
So that's interesting. You had asked me, well, what did I do in all these years, between selling the business and just a little snippet of that. So my son is on the autism spectrum. So I wound up spending hours and hours and hours a week in the car. This is not why I sold the business. He had no diagnosis when I sold, but a year or so later, give or take, he had this diagnosis, and I always knew something was different. But, doctors blow you off. And I even called the insurance company and I explained them, and they go, oh, you just need parenting classes. And I was like, well, that might be true, but that's not what's going on. And so over in the beginning years, it was OT 3 times a week, speech 3 times a week, play therapy 3 times a week. I had my daughter in the meantime, and we did a lot of this. I lived out in East Orlando at the time, and the only preschool that would take my son in at the time was the Jewish Community Center. They're like, let's see if we can meet his needs. So I drove from East Orlando to Maitland twice a day because it was a 5-hour program, and what was I going to do for 5 hours? And I eventually wound up moving actually to Maitland because Maitland's a lot more central point than East Orlando in getting to various help. OT, PT, he never had PT, OT, speech, play therapy, schools. So I had that. And then when my daughter was 8, she was diagnosed with Crohn's. And so then there were just different things we needed to do. And also with my son, there was a lot of home program stuff to do, whether it was brain gym and OT homework and things like that. So when my son was graduating high school, because my kids are in their 20s now, my son was graduating high school, my daughter was in high school, and I realized I don't do that stuff anymore. All that driving was done, all that taking to doctors was done. So what was I going to do? And so I started investigating various jobs, if you would, and what would I have to go back to school for. And nothing really got me passionate, like how I got into chiropractic for another day, but it was like passion. It was like I knew that's what I was supposed to do. And I wasn't finding that pretty much anywhere. And then I also do a lot of, I'm going to call it self-help. There's probably a better term for it, but spiritual journey kind of things. And I had actually done a program an online program with somebody named Marissa Peer, who is a British hypnotherapist. And there are things I like about her stuff and things I don't now, in retrospect, like about it. But I was like, wow, that's something I could do that could help people again. That one, going back to what you talked about caring and compassion. And I was always wanting to look to do something that could help somebody and not just cover up the problem. That's part of the issue with our traditional system is most of the time it just covers up the problem. And even
Right.
traditional psychotherapy takes years and years and years and years. And more often than not, from
A lot
a
of
lot of
money.
money,
A lot
a
of
lot of
money.
time,
Yeah.
and doesn't always get to the root problem. Because the root problem, as we find out in hypnotherapy, is in the subconscious mind, the stuff that's buried underneath. So once I discovered what hypnotherapy was, and so I started researching that, and I got really excited about it. And that was my segue into it. And I actually took Marissa Peer's online course. And then in the process of that, I discovered the school I eventually um, got an accredited degree from. So Marissa Peer's online.
Right.
Think of it more of a certification. And you can practice, by the way, in any state in the country, you can practice hypnotherapy without an accredited program. But I
Okay.
learned so much in my accredited program. And I'm very grateful that I did that. And then I got to see miracles again. So that was exciting.
So I want to speak to that miracle. So one of the things that I was dealing with myself was this tremendous amount of sadness. It,
Mm-hmm.
it was like I always use the old saying, like a wet blanket. It's what it felt like, just walking around heavy all the time. And I remember coming into my first session with you, and I remember you saying to me, which I thought was astonishing, uh, plan for 3 or 4 hours. And I was like, what?
Right.
I don't do 3 hours or 4 hours of anything. It was like, oh, okay. So in my head, I was like, well, she's just giving me buffer time. Like she's just going to get to know me. And you were gracious to say, no, really, we're going to go till we keep going until it's done. Like I expect you to come here once or twice, not every week for 6 months, which was interesting to me. And I remember coming into your office, and I remember the big fluffy pillow. That was my favorite pillow, the fluffy. You had me in the chair. The chair was awesome. I rarely sit down. I'm always running around. And I remember getting super comfortable and you telling me we were going to do these breathing exercises. And I remember doing the in and out breathing and you coaching me. And then I remember it was like being under anesthesia when the doctor says to count backwards
Mm-hmm.
from 100. 199. Now, you didn't have me count, but in my head, I'm floating away as I'm breathing, but I feel the fluffy pillow. It was the weirdest in body, out of body experience I've ever had. And I'm very much a type A control freaky kind of person. And it was control, but out of control. So it was good for me. I knew you were there. You were the safety net. I wasn't like on a ayahuasca
Mm-hmm.
or
Mm-hmm.
trippy experience on drugs or ketamine or anything like that. But you were there. You were my tether. You were guiding me. I was talking to you, but having a conversation with my grandmother who passed away. All these things were happening simultaneously. And I remember because my dog was with me, my sick
Right.
dog Clifford was in a little stroller there in the office. And I remember when we were done, and I had tears streaming down my face. I didn't even know, like, I knew I was crying, but I didn't know
Mm-hmm.
I was crying. And I kind of came out of it, and you kind of looked at me, and we both looked at the dog, and he was just really paying attention, like something had happened to him, to us. And I was
Mm-hmm.
exhausted
Mm-hmm.
when I left. And I went home and I was like, whoa, like big whoa moment. And I told my husband, Jeff, like, wow, like something happened. Something big happened. I don't know what's going to happen
Mm-hmm.
after that, but something happened. And days and weeks later, that blanket came off and I could function like a normal person, or what I thought was normal anyway, in my life. And then I started
Yeah, you
sending
did.
a slew of patients to you because like this is profound. This is bigger than big. So we're gonna have to wrap up in
Okay.
the next 5 minutes. So I wanna bring it to you don't have to tell me exactly what you did, but the technique that you used, what was it supposed to do? And what can it do
Okay.
for other people?
So I never just use one technique in a session. So what you were describing was breath work. So I can talk to that. But if I can just say one thing, people have this misconception in hypnotherapy that you are not in control and that you are totally under the control of the hypnotherapist. And that is the
You're gonna cluck like a chicken, blah
right,
blah
cluck
blah.
like a chicken. And again, just time wise, we can't go into that, but you described it perfectly. In hypnosis, you're in an altered state, but you are always in control. So you can come out of it anytime you want. You don't have to tell me anything you don't want to tell me. You don't have to do anything. But the patients, well, I still say patients when I was a chiropractor. In hypnotherapy, because we are not doctors as hypnotherapists, we'd say clients, but patient still comes out of my mouth just from being a chiropractor. Um, but the client who gets the best results is the person who really wants it and the person who's willing to look at whatever comes up and go with it. And you would think that people coming in really want to get taken care of ASAP, but some people need to go slowly. And that's okay too. And those people, it's not going to be one or two visits. Um, and that's okay. Everyone does things at their own pace. So the technique, to answer your question directly, that we used was breath work. And breath work is a way to get past what we call the critical factor. The critical factor is that gate between your conscious mind and your subconscious, and you have to pass it. You have to get past it to get into the subconscious, to get into the things that happened when you were 1, 2, 3, 4, 5. Because most things that are affecting people now, they think it's because they don't like their job, or they think it's because of all the turmoil that's going on, but it really brings it's other things, beliefs that we have about ourselves and the world that we formed years and years and years ago. So breath work is phenomenally effective. I do want to say that it's really important to have a guide when you do breath work. I know that there are group breathwork sessions that are done. It's not just done by hypnotherapists, and it's real. They might call them rebirthing, but it can bring up some very, very powerful and emotional things that have happened. And so, if you do breath work without a guide, sometimes you're left in this incredibly strong emotional state, and you need someone to guide you through, I think. All right, in my opinion.
You got to close
I'm
the
sorry.
gate.
Yeah,
You got to
well, you
close
have
the
to
gate.
process what's come up too. You need to, why am I having this and how do I process this? Because if you're 5 when whatever is happening happened and you don't have someone help you process it, then you leave the same way you came in. But if you can take a look at those memories that come up and those emotions that come up and process it and realize, okay, well, you're not 5, and this is the decision that the 5-year-old made. But what is the 40-year-old going to make? And what do you need to do to nurture that inner child, that 5-year-old who had this? Because that 5-year-old's still there. And I always talk about your imaginary mom or dad or who's still there. Even if they've passed away, you're still hearing them. So we have to process all that stuff that came up. So doing breath work on your own may not be the best idea, but there are other techniques that people can do that if you ever wanted to, and we do an episode on just some of the neurolinguistic programming stuff that I would also use.
And
NLP, yes.
NLP. Yeah, NLP.
There are things that
Okay.
people can do to, even if it doesn't 100% address the issue, to at least help them through the emotion that they're feeling at that time.
Got it. So up
Mm-hmm.
against the clock a little bit, but I want to end with the fact that you made such a
Thank you.
difference in so many people's lives. It was really remarkable. I mean, I've been doing acupuncture and working with holistic people for a very long time, over 25 years. Just recently attended a conference for the Florida State Oriental Medical Association, saw a bunch of colleagues that I've known for many years, people that talked about new techniques and ideas on
Mm-hmm.
holistic healing and spirituality and keeping healthy. And I have to say, of all the people that I saw there, I kept thinking about you and the effect that you had on, a good number of my clients. So I really wanted to thank you for that and for helping me and for helping my husband, Jeff. And I really look forward to learning more and deeper diving this for other people, because I feel like hypnotherapy has
Mm-hmm.
gotten a bad
Mm-hmm.
rap in the world. And I want to talk about it in all of its science and the background and what people miss, what they gloss over. And again, I had hypnotherapy experiences throughout my entire life, but not like that. So I thank you, and I welcome you to come back when we have a longer podcast time.
Right.
In time.
Thank you. I have to say thank you. You did send me a lot of clients, and I remember every single one of them, and they're all dear to me. And your trust in me is not taken lightly. Thank you.
Thank you.